Hello, my name is Tevito Kweshemanjo. In this short video, I'm going to be demonstrating the non-parental medication. To start with, I have here with me the printed medication record and the physician order. I'm going to be comparing the physician order and the medication record in order to validate my 6 rights, which is the right to patient, right to medication, right to dose, right to route, right to time, and right to documentation. So, going over the physician order and comparing it with the medication record, I have the name of the patient, Buzu Jack, well written in the medication record, MRN 8734651, well written, date of birth plus 6/20/19 that well written, Allen Long, which is the name of the physician, well written. For the date, it asks 02/17/2020, 02/17/2020, then the time 8:30, then the medication, the number one medication is Sevaclor 500 mg PQ 4 hours for infection, which is this right time 8:30. The second dosage is Synthroid 100 mcg PQAM at 8:30 from the physician order, well documented. Synthroid 100 mcg PQAM 8:30 in the medication record. The third medication will be the Nitrobin 2% ultimate tropical QAM 1 inch on patient chest. I have it documented on the medication record and it's to be given at 8:30, and it's also recommended in the medication record and physician order 8:30, which is well documented, and it says allergies, non-known allergies for the recorded information in the physician order and the medication record. Then the physician signed on the physician order, and the person that put in information on the medication record also has append her signature. So for all this medication, I'm going to be having 3 checks. I'm going to be doing 3 checks. So my first check will be going to pull out my medication from the drawer and checking in the nursing book to see if the dosage, the usage is correct. So I'm going to be having the number 1 medication, which is Sevaclor. So pulling it out from the drawer, Sevaclor 500 medication, PQ 4 hours for infection. That is what the doctor ordered. So I'll have to look at the book for Sevaclor. The generic name is Cephalosporin. The dosage says is an antibiotics for the treatment of infection, and it says for an adult between 250 to 500 mg for 12 hours, and the doctor says 500 mg PQ 4 hours for infection, and this one says 500 mg 12 hours maximum per day. Okay, this one says every 4 hours for infection. Okay, I still have to ask my doctor the reason why a one is 4 hours PQ every 4 hours. Okay, there must have been a reason for the physician to have stated that, which I will need to ask about. Then for the usage, it says for the treatment of infection in the medication record in physician order, and for the book it says for the treatment of bacterial infections such as pneumonia, which is right. Then looking at the side effects when you're administering this drug, the side effect for Sevaclor is dizziness, diarrhea, stomach upset, headache, and vomiting. So the doctor has already said it's for the treatment of infection, which is right. Going to the next medication, which is Synthroid. The Synthroid 100 mcg. So I have already pulled out my Sevaclor. I'm sure, but what I have here is 250 mg by 5 ml, but the doctor ordered 500 mg. So I'm going to be calculating the amount of dosage to be administered to my patient. That will be done after I check all this medication. So to check for the Synthroid, it belongs to the generic name levothyroxine. What is useful provide more thyroid hormone for adult less than 50, PQ 16 mcg kg per day. Okay, for the Synthroid. Okay, it says for adult 50 mcg per day administered. Okay, so that's for the Synthroid, which is goes with the range for the age of the patient. So the side effect is sweating, headache, anxiety, nausea, fever, and hot flasher. So those are the things to watch out for when you administer the Synthroid. So let me check for the Synthroid. Okay, I have the correct dosage, which is 100 mcg. So this is okay and perfect. This is what I'll be administering when I get to the patient. I have the 100 mcg. I'm going to put that aside, which is okay. For the Nitrobid, I have the Nitrobid 2% ointment from the drawer. I pull out and I see Nitrobid ointment for topical QAM 1 inch on patient chest. Okay, going by the book, it says Nitrobid is a nitroglycerin, which is for the is a rectal ointment, and it's used for the chronic stable angina pectoris, prophylaxis of angina pain. And it says to administer it should be measured on a paper supply. Use paper to spread on the non-hairy area of the chest, abdomen, thighs, skin, thin layer, spread over 2 to 3 inches. Do not rub. Okay, for the Nitrobid, it says you have to spread it on the paper. So when I get to the patient's room, I'm going to be measuring the required prescription on the paper, which I'm going to be administering on my patient. The instruction says 1 inch on patient's chest, but here it says 2 to 3 inches. There must also be a reason for the doctor to have stated 1 inch on the patient's chest, which I'm going to do when I get to the patient's room. So that is that for my first check. I've done the first check. Now, for the second check, I will have to calculate what I needed to put in the cup, the number of meals to be administered for my patient, especially in the case of Sevaclor, which is a liquid, and what the doctor ordered is 500 mg PQ 4 hours for infection, and I have 250 mg by 5 ml. So I'm going to have my order and my half. So my half is 5 ml over 250, which equals to x over 500. So x equals to 2500 divided by 250. S is equals to 10 ml. So for my Sevaclor, I'm going to be having 10 ml to be given to my patient. So before I do all those, before I measure, I'm going to perform my hand hygiene again. Perform hand hygiene. Then I'll have my glove on, and I'll have my cup seated on the table. Then I'm going to pour my 10 ml. I'm going to do it this way so that I won't over or under measure. I'll do it this way. Okay. Yes. There you go. Here I have 10 ml, which I will be taking to the patient's room. Then here I have my 100 mcg Nitrobid Synthroid, which I'll be taking to my patient's room. Then I have my Nitroid, which I'll be measuring on the paper when I get to the patient's room. So these are the 3 medications that need to be administered at 8:30, looking at my time, and here I'll go with water. So I'll be going to the patient's room. Now I'm in the patient's room. Hello, miss. How are you doing today? My name is Temi. I'm a nursing student from Mountain View College, Dallas, Texas. May I know whom I'm speaking with? Can you confirm by telling me your first and last name and your date of birth? Okay, Miss Buzejak, date of birth 06/2019. Oh, good. Perfect. Miss Buzejak, before I do anything with you today, I am here just to let you know I'm here to administer your medication. But then, let me make you comfortable by making sure your bed is raised to be comfortable, right? Please raise your head up. Are you comfortable? I want you in the seated position so that when you want to swallow your medicine, you won't be shocked. Okay, good. Thank you. Do you have any allergy today? Can you swallow? You sure you can swallow this medication? That's fine. Okay, I'll provide privacy here. Now that we are ready, please allow me to perform hand hygiene. I'll go straight, perform hand hygiene. Okay, going by your medication record and the physician order, I have here Sevaclor 500 mg PQ 4 hours for infection at 8:30. This is 8:30. So here is your Sevaclor. I have measured the amount of dosage to be given at this time. This is 10 ml, which is measured and I'm going to be giving to you. Can you please open your mouth? Good. Do you want water to wash it down? Perfect. Okay, the second medication says Synthroid 100 mcg PQAM at 8:30. Here is your Synthroid. I'm going to be opening this. This is 100 mcg. Can you please open your mouth? Swallow. Good job. Take a water. Thank you. Zip. That is fine. So I have administered my Sevaclor. I have administered my Synthroid. To let you know, the other one that we need to administer is your Nitrobid. This Nitrobid, I'm not going to put it direct. I'm going to measure it here. This is the instruction. The instruction says 1 inch on patient's chest. So I'll measure 1 inch on the paper. So this measured. Can you please open your shirt for me? Good job. So I'll put it on the chest. So, Miss Buzejak, today I have been able to give you the 10 ml of Sevaclor for the treatment of infection according to your medication record by your physician and stated in your medication record. I have been able to give you 100 mcg of Synthroid, which is to help your hormone, your thyroid hormone. So, and I've always been able to put the paper of the ointment bead, Nitrobid ointment on you. Please, the instruction says do not rub. Please leave it there, let it work, and you will see the changes. So that is that. Do you have anything to tell me? Do you have anything of concern? Okay, if you don't have anything to tell me, if you don't have any issue at the moment, please, here is your bell. I have to be stepping out. Feel free to call me and let me know in case you have anything to discuss with me. Thank you, Ms. Jack. Keep relaxing and enjoy yourself. So let me place your bed back in a comfortable shape. Okay, I'll perform hand hygiene. I'll step out of the room. Thank you. Now, for sublingual and the buccal medication. The sublingual medication goes right under the tongue. You lift the tongue up, you put it under the tongue. You allow it to dissolve naturally. I'm going to tell my patient you do not eat, you do not drink, you do not swallow, you do not chew this medication. You allow it to dissolve naturally. For buccal medication, what you need to do is put it at the gum. It is in between the cheek and the gum. You put it at the gum, in between the cheek and the gum. You allow it to dissolve naturally too. You don't eat, you don't drink, you don't chew, and you don't swallow while you're taking the buccal medication. So for buccal, for sublingual, those are the instructions that goes with the two medications. So for eye drop, to instill eye drop, I'm going to educate my patient that they will be experiencing some burning sensations, but the steps involved is I'm going to have my patient to, first thing I'll do is I'll perform a hand hygiene. I'll put on a new glove and I'll hold the cotton ball tissue or the cotton ball or the tissue. I'll hold it in my hand below the lower eyelids. Then I will ask my patient to look at the ceiling, to look up at the ceiling. Then I will hold the dropper I'll hold the dropper above the conjunctival sac. So I'll now instill the number of drops in the eye. This way, we instill the number of drops while the patient is looking at the ceiling. So I'll instill the number of drops. Then I will apply gentle pressure to the lacrimal duct. So that is that. In case it's an ointment too, I'll apply gentle pressure on the lacrimal duct. I'll ask my patient to please close your eyes. That is for the eye. Then for the hair, when I'm doing the hair, I will have to pull the pinner up and backward. Then I will instill the number of drops in the hair, and I will ask my patient to remain in that position for like 5 minutes, like sideways, side laying for like 5 minutes. That is for the ear drops. And for the nozzle, I'm going to ask my patient, I'll warm the medication under room temperature. I'll warm it under the room temperature on my palm. So I'll ask my patient to please, I will hold the first thing to do in that case is I'll perform hand hygiene, please. After performing hand hygiene, I'll make sure I have my patient to please stay in a supine position with the head tilted to the back. Then I will instill the number of drop in the above the nose. So that is that for the nasal drop. Then I'll apply hand hygiene again in a situation where you are applying a patch on a patient. What I'll do is I will carefully remove the old patch and I'll put it in the biohazard. After I perform hand hygiene, I'll carefully remove it and put it in the biohazard. Once I put it in the biohazard, I'll make sure I clean the residue. I wash it up. I wash the residue area. I wash it very well. I'll perform hand hygiene again. Then I'm ready to apply a new patch. In applying a new patch, I'll put the date and I'll put the initials and the time on the patch. I'll put it on non-hairy portion, on non-hairy part of the body. So and I'll put the patch. That is that for the patch. Then I'll remove my glove. I'll perform hand hygiene. Then that is that. Then for my animal, what I'll do is, in case I'm performing it on the bed, I'll make sure the 2 rails are up, and I'll make sure on the bed there is a waterproof pad placed on the bed. While the 2 rails are up, I'll lower the rails where I'm working, majorly maybe the right rails. I'll lower it. I'll leave the left rail up. I'll make sure my patient is sleeping sideways, facing the left side to protect and guide him or her from falling. I'll make sure there is a bedpan, there is a commode around me for the patient, in case when we perform the animal, the patients want to go to the bathroom. Once I have those done, I'll make sure the rectal tube is lubricated. You lubricate the 3 to 4 cm of the rectal tube. So then I will locate the buttocks where there is a part of the bed already. With my gloves on, I will gently put it in the anus towards the umbilicus. I will insert it on the anus. So I will do it gently. After doing that, I will now have to give my patient like between 5 to 15 minutes for the patient to go. Once the patient can access bedpan, commode or the toilet, the patient can go. If the patient can control himself, and in case the patient cannot control himself on the bed, there is no problem. I've made provision for everything. Then after that, I'll provide parental care. I'll provide parental care for the patient. Then the last thing is I'll lower the bed. I'll make sure the patient is comfortable. Then I'll remove my hand glove and I'll perform hand hygiene. Thank you.